Do you have IBS, Crohn's, colitis, leaky gut? I'm going to show you with my pipe cleaner diagram right here. My name's Mike, the Heal Your Gut Guy, and I've recovered from Crohn's and colitis, and I've helped many people get better from all sorts of gut issues. And I have a free webinar where I go over all the details. Uh, it, it will greatly help you even if you are undiagnosed and have no idea what you have. So here is, so like imagine the stomach's right here, gets digested and it goes into the small intestine. And then then it gets to the last part of the small intestine, the ileum, this red part right here. Then it goes into the colon. This is called the ascending, transverse, descending, sigmoid, and then it gets pooped out. Now, let's start with the easiest one first to get diagnosed with. It's the easiest to diagnose. Colitis. Now, what does this word mean? So it means colon is inflamed. The first part of the word is the colon, means the colon, and then you slap the word itis onto it, and it means the colon is inflamed. Now, most of us don't know or really understand what inflammation is, including your GI doctor and most of the holistic community. They just don't know what it is. They don't understand it. It is your body's healing response to injury. Yes, it's bad that it's there, but it's the only way for you to heal. We need to ask ourselves the question, what is injuring the gut? Not how do I suppress the healing response of the body? Get it? It's like being mad at the firemen. It's like blaming the firemen that your house is on fire. Like, no, they're trying to put out the house. They're trying to fix the fire. That's what inflammation is trying to do. We got to find the injury, which I will tell you. But colitis, all they do is they stick a camera up the colon right here and they see if it's inflamed. They see if there's polyps. That's all they're looking for. And if they see pockets, they'll call it diverticulitis or diverticulosis if the pockets are there and they're not inflamed. They will call it ulcerative colitis if there's a lot of bleeding when they look up there. But, the difference, it could be a day difference between whether you have colitis and ulcerative colitis because, 1 month you could be in lots of pain and there's blood coming out of you. And then the next week you're fine. Well, you're not fine. Maybe you still have diarrhea, but at least there's not blood coming out. So colitis and ulcerative colitis are really just, they're not even cousins. They're the same thing, just more intense forms of one another. And I would also say that with diverticulitis being the most intense form of colitis. Now, I know what I'm telling you is not mainstream, but still nonetheless correct. So the next one is Crohn's disease. Now, if you look up the definition of Crohn's disease on Wikipedia or the Mayo Clinic or whoever, WebMD, they're all going to have slightly different definitions. And the guy who discovered Crohn's disease, Dr. Burrell Crohn, hated this term. He said, please don't use this term. Please use the term regional ileitis. This red right here is the last part of the small intestine, also called the ileum. And there would be what he would discover, because he was doing this in like the 1920s and 30s. It was very hard to see this part of the intestines. Like, you can't stick a camera all the way up there, only if you do a capsule endoscopy, which isn't really all that popular. They usually find inflammation in the small intestine when they do an MRI or an X-ray. And then usually when they find inflammation in the small intestine, that's when they're going to diagnose with somebody with Crohn's disease. Even though it's supposed to mean inflammation anywhere from mouth to butthole, the term doesn't get used. It's a horrible term. I wish they would stop using it. It just creates mass confusion. It should be called regional ileitis, but usually people get again. It depends on which way the wind is blowing. It depends on the mood of your GI doctor or whoever when they're reading your lab report. Crohn's disease usually gets diagnosed when someone finds inflammation in the small intestine. And then IBS is when somebody has symptoms like diarrhea and constipation, but when they do these tests, they can't seem to find inflammation anywhere. Um, so like that's usually the process of getting diagnosed. And then they're going to do, sometimes they do, well, they usually always do blood tests to see if inflammation levels are high. And then sometimes they'll get a stool test to see if inflammation levels are high in there as well. That's how you do it. We're just looking. All these words mean is there inflammation here or there? I can't find inflammation anywhere. Then I'm going to diagnose you with IBS. Now, the inflammation is healing injury. Now, where is that injury coming from? Where is it coming from? Some people think it's from bad foods, but that doesn't make any sense because, like, think about if somebody eats a bad food, right, and they have colitis. You're telling me that bad food went all the way through the digestive system, did not cause inflammation anywhere except in the colon? And the colon doesn't even digest food. Really, what's going on here? I go over what's going on and how to fix it. I've done it myself. I've helped many other people do it. When doctors and when all the holistic drugs and probiotics didn't work, I'll show you how I got better in my free webinar. It's helped many other people. It's absolutely free.